Welcome to the cardiac stress test algorithm presentation. This clinical decision-making flowchart is designed to evaluate chest pain and myocardial ischemia. Presented by Dr. Adebola Adetiloye, this guide aims to enhance your understanding of stress testing in cardiac care. In this introduction, we outline the approach to cardiac stress testing for patients with suspected ischemic heart disease. The focus is on decision-making based on exercise capability, EKG findings, and contraindications to stress agents. Cardiac stress testing is crucial for diagnosing myocardial ischemia in patients with chest pain or suspected coronary artery disease. It also monitors coronary artery disease by increasing myocardial oxygen demand through exercise or pharmacologic agents to identify perfusion defects. There are two main types of stress testing: exercise stress tests, using equipment like treadmills, and pharmacological stress tests, using agents like adenosine. Each type has specific applications and benefits in assessing cardiac function. Baseline EKG abnormalities such as STT wave changes, left ventricular hypertrophy, and ventricular pacing can limit the interpretability of standard exercise EKG tests. These factors must be considered when choosing the appropriate stress test. Pharmacologic stress agents like dobutamine and vasodilators mimic exercise effects by increasing heart rate and blood flow. They are essential for patients unable to perform physical exercise, revealing perfusion defects in narrowed arteries. Contraindications to vasodilators include severe bronchospastic lung disease, AV block, and low systolic blood pressure. Caffeine or theophylline use within 12 to 24 hours can blunt the effects, requiring careful patient assessment. This image illustrates a cardiac stress test in progress. The patient is monitored for EKG changes and blood pressure responses, providing critical data for diagnosing myocardial ischemia and guiding treatment decisions. The flowchart outlines the decision-making process for stress testing. It begins with assessing exercise capability, followed by choosing between exercise or pharmacologic stress tests based on EKG abnormalities and patient conditions. Step 1 involves identifying clear indications for stress testing, such as evaluating chest pain, assessing coronary artery disease, and preoperative cardiac risk assessment. These criteria ensure appropriate test utilization. Step 2 emphasizes the importance of ruling out contraindications before stress testing. Conditions like recent myocardial infarction, unstable angina, and severe hypertension must be stabilized to ensure patient safety. Step 3 assesses the patient's ability to exercise. If musculoskeletal or neurological limitations exist, pharmacologic stress testing is recommended. This step ensures the chosen test aligns with the patient's physical capabilities. Step 4 involves evaluating the baseline EKG. If normal, an exercise EKG stress test is performed. Abnormalities like STT changes or ventricular pacing require alternative testing methods, such as echocardiography or perfusion imaging. Step 5 focuses on pharmacologic stress testing for those unable to exercise. The choice between vasodilator and dobutamine stress depends on the presence of bronchospasm, ensuring the test is safe and effective. Step 6 addresses special imaging considerations for patients with left bundle branch block or ventricular pacing. Myocardial perfusion imaging or cardiac MRI is preferred, with PET offering superior image quality in certain cases. This slide compares exercise EKG and exercise echocardiogram tests. Both are vital for assessing cardiac function during physical stress, providing insights into myocardial perfusion and potential ischemia. Pharmacological stress tests include stress echocardiograms and nuclear stress tests. These methods are crucial for patients unable to exercise, offering detailed images of cardiac function and blood flow. Stress cardiac MRI provides comprehensive imaging of the heart under stress conditions. It is particularly useful for detailed anatomical and functional assessment, offering high-resolution images without radiation exposure. In summary, assess exercisability, check EKG for abnormalities, and choose the appropriate stress modality. Consider MPI for LBBB or ventricular pacing, tailoring testing to individual patient characteristics for optimal accuracy. Thank you for listening to this presentation on the cardiac stress test algorithm. We hope this information enhances your understanding and application of stress testing in clinical practice.